to use the U225. Avoid applying pressure when placing the U225 in contact with the skin. The slightest pressure will compress the skin tissue and impair the depth setting for needle penetration, so be careful. The U225 should never be positioned perpendicular to the skin. To facilitate the needle entering the skin, you should use an angle of 45 degrees. To achieve this, we take our bearing from the ridge of the single-use transparent guide. You can actually see a shadow when the ridge touches the skin. The patient confirms the absence of any pain or discomfort. This makes the U225 the ideal tool for aesthetic medicine treatments. Avoid sliding the U225 on the skin and lift it slightly between injections. The U225 is excellent even in the trickiest treatment areas. We are going to treat the zone above the lip, an area that is usually very sensitive. Here, the U225 can play a valuable role in age prevention, reducing the appearance of fine lines. As you can see, the micro-injections are not causing the patient any pain or discomfort. There is no bruising or significant bleeding. The same can be said for the delicate area around the eyes, where the U225 can be used in rejuvenation and age prevention treatments. On the face, we usually use a depth of 2 mm for needle penetration. The precision of the injection head and correct positioning ensure a safe and pain-free treatment of these zones. Before treating the area beneath the eyebrows, we first reduce the injection depth to 1.5 mm to avoid any discomfort and to ensure a fluid motion. Lines on the forehead can also be improved with micro-injections. Lightly lift the U225 between injections to avoid slipping and possibly scratching the skin. We treat the same areas on the other side of the face. It is preferable to make the injections as close to each other as possible to ensure an even distribution of the product under the skin. It is strongly advised to reduce the syringe pump pressure to produce the smallest droplets of the product. From time to time, tiny droplets may appear on the surface of the skin. You should never wipe these off, but allow them to be absorbed gradually, which should only take a few minutes. Before treating the area beneath the eyebrows, we first reduce the injection depth to 1.5 mm to avoid any discomfort and to ensure a fluid motion. This completes the first manual phase of the mesolift. As you can see, the injection rate has been relatively slow so far. Moving on now to the second automatic or high-frequency mode phase, with the U225 it is possible to perform over 425 injections per minute. This helps to stimulate elastin fibres in cases where the skin is much more damaged and will allow us to treat areas where the skin has visibly stretched and sagged. Before we begin, we can test the size of the droplets on sterile paper to be sure that they are the right size. Adapt the pump pressure to produce very fine droplets. Be sure to follow this guidance previously given, going carefully, moving the U225 lightly over the skin without exerting pressure and holding the needle at 45 degrees. If you follow these guidelines, no discomfort should be experienced by the patient. We verify this. Avoid sliding the U225 and take your time to gradually cover the entire face. Make sure that the angle of 45 degrees is respected and slightly lift the U225 as you move gradually from one area of the face to another. This way you will not scratch the surface of the skin and ensure an even spread of the product. Take your time to progressively cover the different facial areas. Don't be tempted to rush. Of course, in future sessions, you will be able to concentrate on areas that have been more exposed or damaged. This second high-frequency phase should not exceed 5 minutes on each side. You can calculate that in those 5 minutes, the total number of injections made will be in the region of 4,250. By using the high frequency, you are greatly increasing the effectiveness of traditional mesolift methods and helping to fight against premature aging of the skin by improving its tone and elasticity. Follow-up sessions are recommended at the rate of 2 per month. We move now to the eye area, remembering to alter the injection depth before treating above the eyes. The meso products used hydrate the skin through a blend of micronutrients, amino acids, multivitamins, oligoelements, nucleotides, antioxidants, and a certain quantity of hyaluronic acid. You can also envisage treatments using platelet-rich plasma, or PRP, for which the U225 is particularly well adapted. 1 session per month for the first 3 months should be performed, and then aim for a total of 6 sessions per year. During the treatment, you will notice a slight rash appearing. The patient may feel some tightness in the skin due to the action on the elastin fibres. This sensation should disappear in about an hour. At the end of the session, we can see that on the right side where we started, the skin is virtually dry, indicating that the droplets have been completely absorbed whilst we treated the left cheek, where there is still some surface moisture. This will in turn be absorbed in 1 or 2 minutes. The patient feels a warm tingling on her skin, but no other discomfort. She is also aware of a slight tightening sensation on the lower part of her face. This is normal after the treatment and simply indicates that the elastin fibres have been considerably stimulated during the session. We can now turn our attention to the neck and décolleté. In general, for the whole face, you will need about 3 to 4 ml of product. Here, we will need more. In fact, up to 6, 7 or even 8 ml. There is nothing significantly difficult about this area. You just need to follow the same principles as before. A visible difference will be seen after 3 to 5 sessions, and then follow-up sessions from time to time will help to maintain results. You can, of course, concentrate on areas that are particularly susceptible to fine lines, especially due to prolonged sun exposure. We can follow the fine lines along the neck to effectively stimulate the elastin fibres. No anaesthetic is necessary when using the U225. The fact that the process is pain-free means that the treatments are even more effective, especially as there is no vasoconstriction, typical when using anaesthetizing creams. We are reaching the end of the treatment for the face, neck and décolleté, which will have taken a total combined time of 20 to 30 minutes. If you are only treating the face, this should take no more than 15 minutes in all. The backs of the hands are particularly improved by using mesotherapy. Remember that the skin here is very fine and that the presence of veins and tendons requires the needle penetration depth to be reduced to a maximum of 1.5 millimeters. Where the skin is especially fine or an area is difficult to treat, use your free hand to gently push the skin up to make it thicker and to allow the needle to pass safely. This treatment nourishes the connective tissue that has naturally dried up over time, and at least 5 sessions will be necessary to obtain visible results. Follow-up sessions throughout the year are recommended. 1 or 2 ml of product is sufficient for treating both backs of the hands, using 2 separate phases of manual and high frequency. For age prevention, platelet-rich plasma, PRP, is one of the most effective tools for improving the skin. The inner side of the arms are often areas where sagging can occur. Mesotherapy is very effective here for improving skin tone and elasticity, notably when using the high-frequency mode of the U225. Firstly, clean the skin with antiseptic. Then, reset the needle penetration depth to 2 mm or 2.5 maximum and start the two-phase treatment as outlined previously. You will need to cover the whole area evenly to ensure improving overall skin tone and the total absorption of the product. It is better to go steadily and surely. Focus then on the very inside of the arm, as this is the place where the skin tends to slacken the most. Normally it takes 5 minutes to do the whole inner arm using 2 ml of product. Leave the arm to dry so that all of the product is absorbed from the surface. Once dry, a calming and hydrating cream may be applied. When treating cellulite or orange peel skin, clearly the idea is to improve cutaneous trophicity. First, disinfect the area. Use the U225 in manual mode to inject along the length of the thigh. The needle penetration setting should be at 3 to 4 millimeters. The treatment of alopecia is particularly effective using the U225. In women, notable hair growth is stimulated. In men, it stops hair loss and improves the overall density of the hair, whilst promoting a better scalp and thicker individual hairs. The hair is parted and the area disinfected before injecting in manual mode. The needle penetration dial is set between 4 and 5 millimeters. Coverage is easy, as you simply run along the exposed and disinfected parting line. Due to the highly sensitive nature of the scalp, many practitioners choose not to provide this type of treatment using traditional needle methods. With the U225, pain-free treatment is now possible. Continue to part the hair every ½ centimetre and repeat the process over the upper part of the head. There is usually no need to go as low as the temple, as hair loss is virtually nil in this area. When using a vitamin mix, hair growth will normally occur in women after 2 to 4 sessions at the rate of 2 per month, over a minimum of 6 months, and then with follow-up sessions afterwards. The patient feels absolutely no pain. For men, treatment is continued over the year at a rate of 1 session per month to maintain results. High frequency can be used to stimulate the scalp at the end of the treatment session. You can even use platelet-rich plasma, PRP, instead of the vitamin mix, in which case the number of sessions will be considerably fewer than those using the blend of vitamins. It is clear from this demonstration that using the U225 is pain-free, regardless of the specific application or sensitivity of the zone being treated. The high-frequency mode greatly increases the effectiveness of these types of treatments, and this has been backed up by scientific evidence. As a dermal injector, the U225 is at the very pinnacle in terms of its design, the quality of its components, the high technological precision used in its manufacturing process, its versatility and pain-free application. It is a major tool for practitioners looking to provide quality, effective treatments in total comfort and control.